Welcome to meeting number 15 of the House of Commons Standing Committee on Industry, Science and Technology. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021. The proceedings will be made available via the House of Commons. So you're aware the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I'd like to outline a few rules to follow. Members and witnesses may speak in the language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either floor, English, or French. Keep it for those before speaking, please wait until I recognize you by name. If on the video conference, please click on your microphone icon to unmute yourself. Those in the room, we don't think we have anyone in the room. Your microphone will be controlled as normal by Proceedings and Verification Officer. A reminder that all comments by members and witnesses should be addressed through the chair. When you are not speaking, we ask that your mic should be on mute. With regard to the speaking list, the committee clerk and I will do our best to maintain the order of speaking for all members. As is my normal practice, I will hold up this yellow card for when you have 30 seconds remaining in your intervention, and I will hold up the red card for when your time for questions is up. Please keep an eye on the card and respect the time limit so that everyone has a chance to ask their questions. Pursuant to Standing Order 1082 and the motion adopted by the committee on Tuesday, December 1st, 2020, the committee is meeting today to continue its study on the domestic manufacturing capacity for COVID-19 vaccine. I'd like to now welcome our witnesses. With us today, we have Minister Anita Anand, Minister of Public Services and Procurement, Mr. François-Philippe Champagne, Minister of Innovation, Science and Industry. From the Department of Public Works and Government Services, Mr. Bill Matthews, Deputy Minister. From the Department of Industry, Simon Kennedy, Deputy Minister, Innovation, Science and Economic Development. And National Research Council of Canada, Mitch Davies. I'm getting a note from the clerk that we need to pause for 1 moment. I think we're having some sound issues in the room, so I will suspend for 1 moment. Will resume the meeting. Thank you very much. Each witness will present for up to 7 minutes, followed by rounds of questions. So we will begin with Minister Anand. You have the floor for 7 minutes. We are not getting any sound, Minister Anand.
How's that?
Perfect. Please go ahead.
Okay. Bonjour tout le monde. How's everyone doing? Great to be here with you. I want to thank you for inviting me to be here with you this morning. And before we start, I would like to take a moment to acknowledge that I'm meeting you from the territory of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I would also like to thank everyone who means to make these virtual meetings possible, especially our interpreters, our translators, for playing such an outstanding role in the ability for Canadians to understand and process this information. Joining me today is my Deputy Minister, Bill Matthews. Thank you, Bill, for being here. I want to speak first about the PSPC response to the pandemic. In the face of intense pandemic fatigue and strain, Canadians have pulled together to curb the spread of the virus. I know I speak for all parliamentarians, and particularly those of us in this room today, that we wish to thank the doctors, the nurses, and the healthcare providers who are working tirelessly on the front lines. Their work is crucial, and that is why, since the start of this pandemic, my department at PSPC has worked nonstop to procure vital PPE and other medical supplies for frontline workers. In terms of domestic production, we should recognize Canadian suppliers who have stepped up to fight COVID-19 with us. Many Canadian companies increased their levels of production to provide vast quantities of the items we so urgently need. Protecting our frontline medical professionals was and continues to be a top priority. Early on, we finalized a long-term contract with Medicam out of Montreal to produce tens of millions of N95 respirators and surgical masks annually. We have already taken delivery of 18 million made in Canada surgical masks and more than 5.7 million made in Canada N95s from Medicom. Throughout the pandemic, more and frequent testing has been critical in order to prevent isolated cases of COVID-19 from becoming renewed outbreaks. Lumen Ultra, a leading biotech company based in New Brunswick, stepped up to produce large amounts of reagent to support COVID-19 tests right through to March of this year. While many businesses ramped up existing production capacity, some companies completely retooled their production lines to meet the country's needs. For example, Bauer in Quebec switched from making hockey equipment to making face shields for frontline workers. Toronto Stamp pivoted from making signage to kickstarting a project involving more than a dozen Toronto businesses to manufacture face shields. The Calgary-based chemical processing and manufacturing firm Fluid Energy stepped up to produce millions of liters of hand sanitizers to ship across Canada. And the list goes on, Madam Chair. Stanfields in New Brunswick has provided us with 100,000 medical gowns per week, for example. Irving Oil, based in New Brunswick, retooled their lines to produce hand sanitizer. Madam Chair, these companies are just a handful of the many innovative and dedicated firms across our country who have stepped up and worked to make sure that our frontline healthcare workers are protected. Moving now to vaccine procurement. We know that the quickest way to get to the other side of this pandemic is to follow public health advice alongside of a successful vaccine rollout. While our government is investing in the future of domestic vaccine production, my department continues to fight the pandemic today with a strategy that is getting authorized vaccines into the country as soon as possible Madam Chair, from the start, our government's objective has been to secure safe, effective, and necessary vaccines for Canadians as rapidly as possible. Our work was guided by the Vaccine Task Force, the creation of which was a key element for our country's vaccine strategy. In all, our government managed to gain access to nearly 400 million doses of potential vaccines from 7 different candidates, resulting in one of the most robust and diverse portfolios of COVID-19 vaccines in the entire world. Through the establishment of these agreements, we negotiated the quickest delivery options possible. Following the Health Canada approval of Pfizer and Moderna, we have received and distributed more than 1.1 million COVID-19 vaccines to provinces and territories. Between Moderna and Pfizer alone, we remain on track to have enough vaccines to immunize everyone in Canada who wishes to be immunized prior to the end of September. In addition, through the COVAX initiative, Canada will receive at least 1.9 million doses of the AstraZeneca vaccine, which is close to receiving Health Canada authorization. Should the vaccine be authorized, deliveries could begin arriving before the end of March. Madam Chair, we also continue to work closely with the 5 remaining manufacturers with whom we have bilateral agreements: Sanofi GSK, Medicago, AstraZeneca, Johnson & Johnson, and Novavax. Our goal is to get more Health Canada approved vaccines into Canada as quickly as we can. While vaccines are critically important, so are the supplies needed to administer them. For example, we have secured more than 170 million syringes of varying sizes from a range of suppliers. And this includes 64 million of the low dead volume syringes, which are in extremely limited supply around the world, and approximately 1 million of those specialized syringes is arriving in Canada this week. In closing, Madam Chair, throughout the pandemic, every single time we have asked Canadian companies for help, they have stepped up and delivered. In addition, we have made sure that we have critical made in Canada PPE and medical supplies to meet our country's needs. Keeping our loved ones safe is our top priority. Thank you for your time. I'm happy to take your questions. Merci beaucoup.
Thank you very much, Minister. J'invite maintenant Ministre Champagne.
And I'd like to invite the Honourable Minister François-Philippe Champagne to take the floor. You've got 7 minutes. Thank you, Madam Chair, and good morning, members. It's an honour for me to take the floor today as the Minister of Innovation, Sciences and Industry to tell you about the state of play on the government's efforts to ensure that we can have inoculation of the population against COVID-19 from the outset. I think on behalf of all the parliamentarians and officials who have pulled out the stops over the last months and over the last year to ensure the safety and security of Canadians, and in particular Deputy Minister Mr. Simon Kennedy and also Mitch Davies from the National Research Council of Canada, and of course Mr. Bill Matthews, the Deputy Minister of Ms. Anand, who has done remarkable work as well. Canada has guaranteed access to the most promising vaccines that are under development in the world. The government has also acted to increase the vaccine manufacturing capacity in Canada in order to contribute to ensure long-term pandemic preparedness.
Pandemic began, Canada had no flexible, large-scale biomanufacturing capacity suitable for a COVID-19 vaccine. It is important to remember how we got to this position. For the better part of the 20th century, Canada played a key role in the development and global production of biopharmaceuticals, probably through the work done at the Connaught Medical Research Laboratories in Toronto. That changed in the 1980s when the government of the time decided to privatize the Connaught Laboratories. Within 10 years, Canada's domestic biomanufacturing ecosystem has eroded. Although companies perform a considerable amount of R&D here in Canada, few products were commercialized for public use. Then the previous government cut the funding at Industry Canada that supported life science companies and attracted new investment in Canada. Depuis lors, un certain nombre d'entreprises.
Since then, a significant number of companies and investments have left Canada, and here are a few examples. 2007, AstraZeneca closed down its manufacturing activities in Canada and consolidated these activities in its manufacturing facilities that are based in Sweden. In 2010, Johnson & Johnson closed down its research centre in Montreal. In 2011, Teva closed one of its manufacturing Canadian plants here in Montreal. And in 2013, Boehringer Ingelheim closed its R&D centre in Laval, which was concentrating on hepatitis C and HIV. So also, colleagues, in 1973, around 19% of Canadian domestic demand for vaccines and therapeutic drugs was met by imports. Today, Canada imports 85% of its vaccines and therapeutics.
From the earliest stages of the pandemic, our government recognized the need to increase our domestic capacity to make vaccines and therapeutics in Canada. We invested early and significantly. I would say that we took immediate actions with a long-term vision. And let me highlight for you colleagues a few of the many investments we made since March 2020. Mais ce qu'il faut rappeler aussi, Madame la Présidente, c'est qu'en général,
we have to recall also, in general, setting up a new pharmaceutical manufacturing facility has to follow, of course, good manufacturing practices, and normally it can take 2 to 5 years. Given the crisis, we're going to make considerable efforts to expedite this and cut down on the timing required. We've invested $126 million to construct a new biologics manufacturing centre in the Royal Mount campus of the National Research Council. Once it's fully up and running later this year, this new centre will be able to domestically produce around 2 million doses of vaccines per month. This week, we have signed a memorandum of understanding with Novavax to continue with domestic manufacturing of its COVID-19 vaccine in this new biologics manufacturing centre in Montreal. The government has also invested $44 million to build a clinical test manufacturing centre on the Royal Mount campus. That means that the National Research Council will be able to produce material for clinical trials and also possibly emergency vaccine doses.
We also invested $23 million to help the University of Saskatchewan's Vaccine and Infectious Disease Organization International Vaccine Center, or as we call it, the VIDO Intervac, to help accelerate the development of its COVID-19 vaccine candidate, and another $12 million to transform its current animal vaccine production facility to meet the standards required for the production of human vaccine. Notre gouvernement sait que le secteur
Our government knows that the private sector plays an important role in research and development to encourage the development of vaccines and also to further biomanufacturing capacity. So the government from the outset, in the first few months of the pandemic, dedicated $792 million under the Strategic Innovation Fund in order to design vaccines and therapeutics here in Canada, as well as to strengthen the biomanufacturing activities. And colleagues in Quebec will know that Medicago, a company that's got over 20 years in producing vaccines, has obtained support that could reach $173 million. And these funds will allow Medicago to expedite clinical trials and also to build a vaccine production facility that will also produce antibodies in compliance with good manufacturing practices. And the government has committed to acquiring up to 76 million doses of the Medicago vaccine candidate if it can prove its efficacy.
The fund has also invested up to $56 million in Variation Biotechnologies to develop a COVID-19 vaccine in its Ottawa research facility, and up to $25 million in Precision Nanosystems of Vancouver to support their breakthrough lipid nanoparticle technology. In conclusion, Madame la Présidente, le gouvernement est
Madam Chair, the government is aware of the fact that efficient vaccine rollout is the best way to restart the Canadian economy while also protecting Canadians' health in the long term. In the fall economic statement, we committed to exploring means of reinforcing the biomanufacturing capacity and how we could intervene in long term in Canada in the event of a pandemic. Canada wants to move ahead, drawing on its talents and its innovative edge. We're able to benefit from the collective effort of highly competent people.
Let's seize the moment. Let's be ambitious, and let's together build a resilient biomanufacturing sector here in Canada. Madame la Présidente, je m'arrête là et évidemment prêt à prendre vos...
Madam Chair, I'll leave it there, and of course I'm ready to take your questions. Thank you very much, Minister.
A round of questions. What we will do is make sure that please, for the sake of translation, do not talk over each other so that translation can do their work. We will start with our first round of questions. The first round goes to MP Cumming. You have the floor for 6 minutes.
Well, good morning, Minister Champagne, and welcome to the committee and welcome to your new role. I look forward to working with you. INDU is going to play a very, very important role in the economic rebound, and you have your hands full. There's lots of work to be done in your portfolio. I want to start by talking a little bit about actually your previous role and get your input as to CanSino and the difficulties that have now come to light with the Chinese government and restricting the vaccines coming back into Canada. When were you aware that there was issues with the deal with CanSino?
So first of all, Mr. Cumming, thank you for welcoming me. I look forward to work with you. You and I already had a conversation, and this is really my style. So let us look back when this all started. We all know that in March 11, the World Health Organization declared a pandemic. At that time and about today, you have about 234 vaccines candidate around the world. And on the advice, to be more specific to your question of the vaccine task force, we did look at the candidate that you mentioned. But this was about for 3 months, something like from April to May to August. And after that, we discontinued the discussion. But even before that, and I think that's important for Canadians who are watching, we were within 12 days of the World Health Organization talking about or declaring a pandemic, we were investing 192 million to have biomanufacturing here in Canada. And within a month, we had invested close to 792 million. So my point is just to put that in context for Canadians watching. When you have 234 vaccine candidates in the world, we rely on science, we rely on the advice of experts. But the episode that you're talking about is a very short episode in a very long process where we looked at that for about 3 months, but then we decided to discontinue the discussion.
But when did you actually provide advice to NRC that maybe this wouldn't be a good company to do business with? And when you saw that the Chinese government was restricting supply, how involved were you? Did you intervene on behalf of Canada with the Chinese government?
Well, like I said, Mr. Cumming, if you look at I would say the portfolio of vaccines we have today, these discussions were for a very brief moment because after that we moved on and we selected the pillars, I would say, which will do that will be the pillar of our resilience here in Canada when it comes to biomanufacturing. You talk about Medicago, you talk about Vino, you talk about Abcellera in Vancouver, and now with Novavax. So my point is that following that, we selected with Minister Anand 7 vaccine candidates around the world. 2 of them have been approved, the Pfizer and Moderna by Health Canada, and that's the rollout that we have in Canada. So the episode you're talking about was just one of the different vaccines candidate that was looked at the very early stage. And then we moved on quickly. And now today we have the largest portfolio of vaccines to provide and obviously to protect the health and safety of Canadians.
Well, let's talk about quickly. So let's go to Royal Mount. And there seems to be some confusion over this facility. And if you take a comparative to the UK, who actually built their domestic manufacturing capacity much quicker than Canada, Royal Mount, the Prime Minister announced that the facility should be open or should be construction complete in July. You were quoted to say, no, fit up's going to take a couple more months. Now we hear that likely, at best, they might get their assembly started and approved by the end of December. And now the discussion is that it may not be into full production until after December, potentially into the new year. Which date is it? When will we actually see vaccine production in Canada?
Well, thank you for the question. And let me be very clear. You have 4 phases when you build a plant. You have the design phase, the construction phase, the certification phase, and the production phase. So I think we should all rejoice first as parliamentarians that Novavax has chosen Canada. When I talked to the CEO, they could have gone in about 7 or 8 countries where they already have manufacturing facilities, but they chose Canada, which is the good news. So what did I say in the Prime Minister is that construction, we expect construction to be completed by the end of the summer. Then you have a period of certification, which could be a couple of months, because as you know, this is about good manufacturing practices, and this is governed by Health Canada in accordance with their processes. And Canadians would understand we want to go fast, but we want to make sure it's that we respect all the health and safety protocols. And following that, we would go in production. So what did I say is that we would be producing a vaccine before the end of the year in that facility in Royalmount. And we are very pleased, I must say, and we should, you and I and every Canadian should think that having Novavax, and we were lucky because in a way, the manufacturing process that we have in Royalmount is compatible with the Novavax vaccine. The second thing that made the CEO chose Canada was speed, and obviously a very stable, predictable security of supply market. I think that's good news because we need to be prudent and resilient for the future.
So did you not look at the potential of retrofit of existing facilities early on to this game? So starting from scratch, foundations, putting up a building, building a brand new facility, where was the effort for a rapid response within, there's lots of industry in Canada.
Well, totally. I mean, and thank you for asking.
MP Cumming, you're out of time, but I will let the minister answer quickly because I know that this is an important subject. And Minister?
Yes, I mean, let me just say to Mr. Cumming, we receive about 87 application under the Strategic Innovation Funds. So I must say we looked at all that, and then we were looking at project, or I would say the task force is looking at project, and their filter is obviously to look at what is feasible, the science, the technology, and what can be deployed very quickly to provide a vaccine to Canadians. That's how they were looking at when they were providing advice to this government.
Thank you very much, Minister. We'll now move to our next round of questions. MP Labropoulos, you have the floor for 6 minutes.
Merci, Madame la Présidente.
Thank you, and thank you to the 2 ministers being here to answer questions. I, first of all, have a question to put to the Honourable Minister Champagne, but if Minister Annan would like to add something, she may do so, of course. I believe that with the Canadian strategy, it's a 2-pronged one. There's the procurement side, and then there's the biomanufacturing side, domestic biomanufacturing. From what I've learnt, it seems that up until now, what we've announced to the public and to Canadians is that we're going to fight COVID-19 by giving a 2-dose vaccine to all Canadians by September. So when it comes to manufacturing here in Canada, how is that going to help us to meet these aims even more quickly? Do you think that we can count on Novavax to meet these objectives before September? Or is this more in the long term? And if the first and the second dose do not work, or if COVID comes back with an even stronger wave, will this help us later on then? Well, I'd like to say a few words and then I'll give the floor to my colleague. First of all, thank you, Ms. Lambropoulos, for this question. I think that the choice of Novavax to set up shop here in Canada is a good choice because, as I often say, we need to take immediate, tangible steps with a long-term vision. And what is our long-term vision? It's to ensure the health and safety of Canadians and resilience and to be prudent as well. And as an Minister of Innovation, we want to bring back as many elements of the supply chain as we can, because we realized that we started on a manufacturing basis that was very limited, and this started some decades ago. But now we're rebuilding this biomanufacturing capacity basis here in Canada so that we can be resilient and actually face up to the future in a more resilient way. So with the NRC and with their Davis, we'll really pull out the stops to expedite the construction of the facility. Royal Mount, there's 4 steps. There's the design, construction, certification and production. And we will do our best to move ahead quickly. But of course, there's other pillars. There's Medico and Quebec, Provincial and Vancouver. And also we've got Vido and Saskatchewan. So together with my officials and the government, we want to build up the different pillars for this resilience so that Canada is in a stronger position and can face up to any health emergency situation in the future. Thank you. And as you've said, in Royal Mount, we will be able to produce 2 million doses of vaccine per month, possibly. Perhaps you've already answered that question, but you said that it's going to be in the next few months.
When do you think is the earliest that we'll be able to start producing these vaccines and getting them out to Canadians?
So let me answer that. So like I said, there's like 4 phases: the design phase, the construction, certification, and production. We have said that we expect, like the Prime Minister said, that construction will be completed by the summer. And then you go into the certification phase, which is an independent process, what we call the good manufacturing practices, which is certification from Health Canada for any biomanufacturing facility in Canada. So this is the period of time which could vary depending on how much time we will be. And then we will move quickly to production. So that's why I said, we will be able to produce before the end of the year. Construction will be completed by the end of the summer. And there's the period in between of certification that obviously we will know when we enter that phase with the independent experts which are going to certify. But the good thing, I think, for us, and I'm sure you would realize, is, again, that Novavax has chosen Canada. Thanks to the policy we placed, thanks to the funding we have said in our view about science. I spoke to the CEO. He was excited to come to Canada. They see Canada as the place to be now. We have proven during the pandemic to be a very trusted partner. I can tell you that as a former foreign affairs minister. The world is looking stability, predictability, rule of law, traceability, security of supplies. We have demonstrated to be a partner of choice to the world, and that's why we can attract these kind of investments in Canada.
Thank you very much. And Minister Anand, with regards to procurement, so far we have 2 vaccine candidates that are going to get us to get vaccinated by September. Obviously, more of them will be approved by Health Canada in the coming months, hopefully, sooner than later. What do you think is the best case scenario? When do you think is the earliest that we can get Canadians vaccinated?
Well, thank you for the question, and it's nice to be able to interject here. I use a 2-track model to analyze this question. The first is based on approved vaccines alone of Pfizer and Moderna, and that is going to lead us to 6 million doses by the end of Q1, 20 million doses by the end of Q2, and 70 million doses by the end of Q3. And so it's based on that analysis that we are using the end of September deadline. But of course, we're going to have hopefully additional vaccines coming online. That's the purpose of our diversification approach to vaccine procurement. And once those vaccines come online and the vaccines arrive in Canada, those timelines can hopefully be moved up. Thank you.
Thank you very much. Notre prochain tour, c'est député Lemire.
And now we have MP Lemire for 6 minutes. Thank you, Madam Chair, and thank you to the ministers. I feel that with this meeting we'll be able to move ahead, and that's not always the case when we have ministers that come for the Industry Committee. The responses don't always bring in new elements, but thank you today. I've got a question to Minister Champagne. What would be the advantages for Canada and Quebec to be autonomous in our pandemic strategies? What's the advantage of being autonomous? Well, First of all, with everything that we've lived over the last few months, thank you very much for your comment, Mr. Lemire, and I'm happy to provide as much information as I can. I think there's a spirit of collegiality and collaboration rather than a partisan approach. We're saving lives and we have to do everything together and take the great ideas. I think there's a real benefit, and that's been welcomed by the Quebec government, to have this Novavax decision to set up shop in Canada and in Quebec, in Montreal. So that shows that in Montreal we have this ecosystem. When I talked to the CEO, we talked about human capital because, of course, I want to give credit to researchers and scientists. If they're coming to Montreal, it's because they think they've got the right human capital. So that will allow us to be self-sufficient. We don't know what the future is going to bring. There will be new variants with this virus. There's lots of things that are coming up. And my task from the outset has been to act urgently to try and attract these investments to Canada and top these up as quickly as possible so that we can be as self-sufficient as possible, and even to have a broader approach together with Minister Anand and look at the whole supply chain to bring it back home as much as possible to Quebec, to Canada, so that we can put everything in place in terms of investment to ensure our self-sufficiency for another health crisis if one were to occur. Now, there's another element that I put to the health minister on Tuesday, and she said I should put it to you. So why are you buying doses rather than licenses that would allow us to produce vaccines here in Canada? Well, perhaps I can let Minister Anand answer that, but there's one thing that I'd like to specify, and then I'll give her the floor. With Novavax, and I will reflect exactly what happened with these discussions. You have to understand that we've got very little manufacturing capacity in Quebec and in Canada that's compatible to produce this type of vaccine. For example, there's GSK in Quebec, but they're already producing the influenza vaccine. So we don't want to disturb that production. But then we've got Sanofi in Toronto, and you're right. But Sanofi is actually producing another type of vaccine. Unfortunately, the minister has frozen temporarily. So, as I said earlier, when I spoke with the CEO of Novavax, the type of vaccine that they have was compatible with the production chain that we can have in the NRC facility in Montreal. So that's why it was useful to go with Novavax to move ahead. Now I'll give the floor to Minister Anand. Thank you.
Merci beaucoup. Je vais répondre.
Thank you. I will answer in English. Sorry about that.
That PSPC proactively and repeatedly approached leading vaccine manufacturers with offers to leverage this domestic capacity and possibility here in Canada. We took this issue up with suppliers at every turn at the negotiating table to discern whether they would come to the table with this possibility of domestic biomanufacturing. The manufacturers reviewed the identified assets here in Canada and concluded that biomanufacturing capacity in this country at the time of contracting, which was last August and September, was too limited to justify the investment of capital and expertise to start manufacturing in Canada. But to be clear, PSPC frequently, forcefully, and aggressively brought this issue to the table, raised it with the manufacturers at every turn. The reality is that standing up new manufacturing of a vaccine requires expertise. It requires resources from the supplier. And given the scarcity of resources, suppliers emphasized locations that had existing capacity and would be able to manufacture quickly at a global scale. That is not to say that the window was closed. For example, we continued discussions with Novavax, as François-Philippe Champagne has indicated, so that there is an option on the table for domestic biomanufacturing. And that is a conversation that we continue to have with vaccine suppliers, with ICED, with Minister Champagne, to make sure that we are indeed keeping all options open for Canadians. We don't know at this time whether this is going to be a vaccine that is going to have to be administered on a year-to-year basis, and therefore we will continue to pursue the domestic biomanufacturing option. But the clear point is that PSPC raised this at all times.
When we put questions in the House on the national strategy, often we hear about the 90 million doses before September, but if we're just investing locally, is that not just admitting that we failed in the past? Well, for those who are listening to us, Mr. Lumia, just to add to that, if we look at the 11th of March, the WHO declared that there was a pandemic. 12 days later, we were already investing 192 million, and then we invested 792 million just a month later in terms of local manufacturing. When we start with such a limited basis, of course, it takes longer than the UK. But I think that between 12 days and then a month, we had already reacted to make considerable rapid investments in order to develop this capacity. Sorry, Madam Chair. Thank you.
Turn to MP Davies. You have the floor for 6 minutes.
Thank you, and thank you to the ministers for being with us. Ms. Anand, if I could begin with you, please. We know that we are not producing any vaccine doses in Canada currently, and we also know that AstraZeneca agreed to allow countries who bargained it to produce its vaccines domestically. Countries like Mexico, Australia, Japan, South Korea, India, and others have done so and are producing AstraZeneca vaccines in those countries. Tell me, did Canada seek this right when we were bargaining our agreement with AstraZeneca?
Thank you, Mr. Davies, for your question. I really appreciate it. And I wanted to mention, first off, yes, I raised this issue personally with AstraZeneca last August. That was not an issue that they wanted to pursue with Canada at the time for the reasons that I mentioned in my last question.
Did they explain why, Minister? I mean, having given that right to so many other countries, did AstraZeneca explain why they would not allow Canada to vaccinate domestically when the National Research Centre has exactly the facilities and technology to do so?
The reasons were multifold, and I believe that you should ask AstraZeneca for a clearer explanation of that. But from my part, I believe it had to do with the scale of production that would be required in terms of building up Canadian manufacturing. And perhaps Francois Philippe can jump in here if he wishes. But there was, and certainly I was raising this point that you're raising now, which is we would like to be able to manufacture here in Canada. By the same token, we wanted to make sure that we could ensure that we had the fastest route to the AstraZeneca vaccine. And the APA was indeed the fastest route as a result.
Okay, thank you.
Now, I'm happy to add if you want, Mr. Davis. Or
that's
not,
okay, Mr. Champagne. I have limited time, so I'll come back to you, but thank you for that. Ms. Anand, if Canada is not affected by EU export controls on vaccines, can you explain why Canada is not on the EU export control exemptions list?
Thank you for the question again. It seems like great minds think alike, as I have raised this question myself. And it is indeed something that we are continually working with. I, of course, am the procurement minister, but I'm working very closely with Mary Ng, the trade minister, and Marc Garneau, our foreign affairs minister, on this particular issue. There has been a number of negotiations in order to ensure that our product can leave Europe. And so far, from my part, I have been assured from suppliers that indeed the vaccines will leave Europe. And I've been grateful for the work that Minister Ng and Garneau have done in order to make sure that.
If I may, have the Europeans given you any explanation for that obvious, very confusing list?
Me personally, no, but I believe that our counterparts are continually in discussion with the EU on this point.
Now, Minister Anand, I know you were a former law contracts professor, so I'm sure you've personally read each of the agreements that we have signed. Is that correct?
Yes, it is.
So can you tell us, what are the intervals of vaccine delivery in the Pfizer and Moderna agreements? Does it set out that we are to receive vaccine doses on a weekly, monthly, quarterly, or other basis?
Thank you for the question. Our vaccine contracts specify quarterly deliveries only. And the reason for that is, and I need to take you back to the month of August, early August, when we were concluding these contracts, that there was no sense of the timeline for the discovery of a vaccine. And indeed, in speaking with one of our suppliers this week, he said to me, we didn't know when a vaccine would be produced. And as a result, we could only commit to quarterly deliveries at the time of
Thank you.
contracting.
Fair enough. Mr. Champagne, you have said repeatedly that we expect to have the Novavax production before the end of this year. Now, I must point out this is not the first time we've heard this. On August 31st, 2020, the Prime Minister's office issued a press release promising production of 250,000 doses of vaccines per month starting last November, with millions, up to 2 million doses per month by the end of last year. Of course, on November 24th, he stated that Canada couldn't meet that because we had no domestic capacity production for vaccines. So with respect, Mr. Champagne, why should Canadians have any more confidence in this latest assurance when the last one proved to be completely wrong?
Well, and thank you, Mr. Davis. And you know, just for the benefit of Canadians watching, you have two different things at Royal Mount going on. You have the 44 million for the clinical trials and the issue that you mentioned, which there was some issue with the certification. But now what we're talking about is a plant that will be able to produce 2 million vaccines per month. And I would say, Mr. Davis, when you have a partner like Novavax, that every country in the world would like to have, that they chose Canada and they chose Royal Mount, I think that should give confidence that we will be able to produce in accordance with the timeline that have been provided.
Well, when Prime Minister Trudeau said on August,
MP
I'm sorry.
Davies, unfortunately, you're out of time.
Thank
We
you,
will now
Madam
go
Chair.
to our next round of questions. Our next round goes to Député Police. Vous avez la parole pour 5 minutes.
MP Paulus, you have the floor for 5 minutes, Paulus. Good morning to the ministers. First of all, for Minister Anand, your colleague, Minister McKenna, said that when we repeat the same thing, in the end, people end up believing us. So it seems that your strategy is that you've signed for all of these contracts of 400 million, but in fact, these are just political lines. In reality, we've got two agreements that are working with Pfizer and Moderna. That's it. But how are we going to make it by September? You keep repeating of this, Prime Minister itself, for the beginning or the end of September. You're saying that all of the Canadians are going to be inoculated. How can you affirm this when we see that there are all these problems with the timing at the moment?
Well, thank you so much for the questions. I will say that, to be clear, the reductions that you refer to were temporary. We had doses leaving Europe from Pfizer on Friday. We have doses leaving from Moderna this week, and Pfizer doses have been cleared also for this week's deliveries, moving into next week also. So it was a temporary and unfortunate and very disappointing reduction in doses for Canada. But as
Madame la ministre, je ne parle pas de réduction, Madame la ministre, je veux savoir.
Madam Chair, was not talking about reductions. Rather, I was saying, how can you make these affirmations when, given that we've got these delays and we've just got two companies, how can you actually assert that this will be finished by September? Because we look at what we see in the Economist Intelligence Unit, they've said that the figures are unrealistic. And when you negotiated the contracts, Canada wasn't at the head of the list of priorities. So this table mentions that there's been bad management of contracts by Canada. Do you agree with this statement? And how can you actually assert that we'll all be vaccinated by September, given all of this?
My goal is to eliminate the rhetoric and to provide the facts. And the facts are that with our diversified approach to vaccine procurement, what we are seeing is 2 vaccine candidates providing vaccines. And when additional vaccines come online, we will see those vaccines being incorporated into the supply chain for vaccines. And indeed, we are providing information relating to the delivery dates for approved vaccines right now so that the provinces and territories can be prepared for what is to come, which is going to be millions and millions of vaccines, especially in Q2. And that is extremely important to note for our planning purposes for each province and territory. Thank you.
C'est bien sûr que les provinces ont besoin.
Yes, we know that the provinces need to get specific information because it's a bit of a cacophony for the moment. Now, with Moderna, there's 40 million doses and up to 116 with Pfizer. So technically, if the contracts are respected, because we don't know the exact clauses, but if we follow what we're saying with Moderna and Pfizer, we would be able to make it to September so that all Canadians can be vaccinated by September without any other companies being involved. Is that right?
Monsieur Mathieu,
Oui, bien sûr, ça c'est correct.
Of course, that is correct. Of course, and this is very, very important. We have to bear this in mind. We have approval for 2 vaccines currently, and there's going to be other vaccines between April and June, and also in the second quarter as well. But if there are other vaccine candidates that come through, then there will be other doses that will come into the country before September. Thank you. So how would you respond to the economists? And they've said that it's unrealistic to think that we're going to receive all of these vaccines as you've laid out, because they've said it's impossible to get all of these on time. They think we're going to overshoot the month of September. Do you agree with what the economist has said, or are you convinced that we're going to get all of our vaccines on time?
Thank you. While I usually do take the economist at face value, I don't believe that that was accurate at all. I believe that we are on track for the end of September, or I wouldn't be saying it repeatedly. I believe that we will have enough vaccines to vaccinate all Canadians by the end of September based on approved vaccines alone. As soon as additional vaccines come online, for example, we have AstraZeneca and J&J in regulatory review, we will have additional vaccines for Canadians. And once again, this is an example of our diversified procurement approach so that we have multiple options for vaccines on the table for Canadians. Professor Susan Athey from the University of Stanford and many others have lauded Canada's vaccine procurement approach as being one that is excellent. Indeed, the CEO of Novavax himself has said that Canada has it right on procurement. Thank you.
Thank you very much, Minister Anand. And I'm just going to remind folks, if you can keep an eye on the card, I want to make sure everyone gets their turn. We now turn to MP Jacek. You have the floor for 5 minutes.
Thank you very much, Madam Chair, and thank you to both ministers for your very clear and I would say frank testimony here today. My first question is for Minister Anand. Minister Anand, I want to get a sense of the scale of what your ministry has been required to do. And so if we could just turn to the beginning of the pandemic when procurement of personal protective equipment was probably on everyone's mind. Could you just go through, you gave us a few numbers, but give us a sense of the scale. What was required? How many different product lines? And also the type of investment that was required to be made in those early days.
Well, thank you for the question. And I would like to say at the outset that we were faced at PSPC with a challenge to procure a number of items of PPE on behalf of the Public Health Agency of Canada in March. And this was required on an urgent basis when the country needed these items. And we moved very quickly to implement long-term contracts so that we could prepare for any eventuality in this pandemic, including a second phase, which we saw. And what we did was to procure over 2.7 billion items of PPE, and we were able to provide that equipment to the Public Health Agency for distribution to frontline healthcare workers across this country. Over 1.4 billion items of that PPE has been delivered. Face shields, gloves, gowns, surgical masks, N95 masks. So that was a massive procurement effort. And I don't want that to go unnoticed because our public servants worked incredibly hard to provide for Canadians. At the same time, there were additional procurements that were needed. For example, rapid test kits. And we moved very quickly to purchase over 40 million rapid test kits for Canadians and distribute those to provinces and territories. Nearly 15.5 million have been delivered to date, and that number is increasing. In addition to that, we then moved to procure vaccines under 7 APAs and put those contracts in place in very rapid succession after we received the advice of the Vaccine Task Force and the Public Health Agency of Canada. And we put those contracts in place, and now we are seeing deliveries into this country, which will rapidly increase as we go through the next weeks and months. That strategy was one of aggressive action and forceful conduct at the bargaining table, and I'm very honored to be on the team that brought that to the fore. By the same token, we are also in charge of ensuring that the supplies and the logistics systems are in place. So count this, the PPE, the rapid test kits, the vaccine procurement contracts, and a logistics system that works end to end so that we can support the delivery of supplies across this country, including vaccine supplies. So, for example, we purchased freezers, a total of 446 deep freeze and ultra deep freezers, gauze, bandages, alcohol swabs, sharp containers, fill and finish machines, all to be utilized in the vaccine procurement and distribution effort. And those supplies are being delivered to the provinces every day because we are in this together. We need to be collaborative. We need to work cooperatively. And that's exactly what I talk to my team about every day. We are working for Canadians to make sure that we are supported as a country through this pandemic.
Thank you very much, Minister Anand. And actually, you didn't mention one particular product, ventilators. And I believe that there was an excellent response from domestic manufacturers in that area as well. Do you recall any details of those contracts?
Well, I'll start and I will ask Francois Philippe if he would like to join in. Of course, I believe his department led a competition for the selection of vaccine manufacturers. And once that selection occurred and the ventilator suppliers, were chosen, then our department supported those choices and executed contracts. In total, we ordered over 40,000 ventilators, and we have received over 22,000 of those ventilators already. And that has been an incredible Made in Canada effort to ensure that we have domestic supply of PPE, including ventilators. And now, of all of our contracts for domestic manufacturing and PPE, we have over 40% are with domestic companies. And so this is an incredible, important effort.
I hate cutting you off because these are excellent questions and excellent answers. And so but my apologies, but I want to make sure everyone gets their turn. Le prochain tour, c'est député Lemire. Vous avez 2 minutes.
So now it's MP Lemieux for 2.5 minutes. Thank you. That's appreciated. So in the emergency law measures for COVID-19 that was adopted March 2020, there was a measure to derogate from the Patent Act when there was an emergency situation up until 30 September 2020 and to import drugs where sales are not authorised in Canada. But this measure was then abandoned on the 30th of September 2020. Why was it dropped then?
Is that a question for me or François Philippe?
Ben, écoutez, je pense que la ministre Anand, c'est plus.
I think Minister Annan knows more than that, but I would like to say something to Mr. Lemire in general. Since we launched this call to action, we've had over 6,800 companies who've wanted to participate in this collective effort. It's almost like an Apollo mission. But just to come back to the questions that were put earlier as to if we had a license, why certain manufacturers have chosen to do things differently is because in Canada we didn't have this manufacturing basis from a volume point of view. We've got the Sanofi, which is our biggest plant in Toronto, and they're already doing something else. So there were questions from Mr. Davis about this, and one of the reasons why the type of contract that we've got in Canada is different is because, for example, with AstraZeneca, they were already in India, they already had a partnership, and they produced 1 billion vaccines in their Indian plant. So even if we look at the facilities that we're building, we have to rebuild from the ground up this manufacturing basis. So that explains our contracts and our choices in the contracts, because if we compare with the UK, it's the same thing. Our manufacturing basis is lower than in the UK. So, of course, the best way was to actually import, as Minister Anand has done. Then, secondly, within 12 days after the declaration of the pandemic, we invested quickly in a significant way to ensure resilience. So pharmaceutics were really flagship in the 1990s, but they have left the country during the year 2000 because the investment partnership program on risk sharing was suspended by Paul Martin. Then it was abolished under the Conservative government with Stephen Harper. So given the failure that we see 15 years in terms of being able to manufacture a vaccine, could we set up this program so that we can get these big pharmaceutical companies to come back to us? Well, I'll try and be brief because I've seen the chairman there. Now, as I've already mentioned in my comments, we know that since the 1980s, many companies have left us. But Mr. Lemire, to reassure you, within 1 month after the pandemic was declared, we had already invested 192 million. And I can give you a long list of the companies that have raised their hand, including many in Quebec in various areas in terms of therapeutics and also the vaccines. Thank you very much.
Goes to MP Davies. You have the floor for 2.5 minutes.
Thank you. Now, Prime Minister Trudeau and both ministers, I think, today have repeatedly emphasized that Canada will receive enough vaccine doses from Pfizer and Moderna alone to vaccinate every single Canadian by September. That's the claim. Now, yesterday it was revealed that Canada is the only G7 country to request vaccines from the COVAX program, which is a global initiative meant primarily to help low and middle income countries get access to vaccines. And specifically, Canada has requested approximately 2 million doses from AstraZeneca, pending regulatory approval, of course, and that's expected to arrive at the end of June. Now, in this regard, we are listed along with countries like Rwanda, Sudan, and Afghanistan, who have yet to receive a single dose of vaccine. We've also made this request of COVAX at a time when the entire continent of Africa has administered about 230,000 doses, and Canada has received about 1 million doses. So a few questions to Minister Champagne. Does it seem morally defensible to you that Canada is taking vaccines from poor countries because we are in a globally competitive environment, as Minister Anand said, some of whom who have received no doses at all, while claiming that we have enough doses to vaccinate our entire population without even touching the COVAX supplies?
Well, Mr. Davis, with respect, I may let Minister Anand to respond because she was more involved than me when it comes to the vaccine procurement.
Okay, so The intention behind COVAX, in order to bring countries together to form this multilateral pooled procurement mechanism, was to ask countries to supply certain funding for their own procurements, and then to also ask them to provide funding for the developing world. And so what Canada did is to step up and provide 220 million for the pooled procurement mechanism from which it could draw as one of those contributing countries to bring doses to Canada. And we also stepped up to provide 220 million for doses for the developing world. So the way in which this procurement approach functions is to allow countries, developed countries, to procure doses for them to use domestically, and also to ask them to provide funding for the donation of doses to the developing world. And Canada is one of the largest contributors to the COVAX facility because of our commitment to the developing world. Indeed, our Minister of International Development is taking a leading position in that alliance because of our belief that until everyone is safe, no one is safe.
Thank you so much. Our next round of questions goes to Député Généreux. Vous avez la parole pour 5 minutes.
MP Généreux for 5 minutes. Thank you, Madam Chair. Can you hear me? Because I wasn't able to do a sound test. All good. Mr. Champagne, welcome in your new role. I'm new in the committee, so I'll be keeping a close eye on you. Well, of course, we're neighbours, so that's all good and well. Now, you've just referred to the Apollo mission when talking about vaccine procurement. So it's like Houston, we have a problem, isn't it? There's something that's not quite working. Minister Anand, I'm going to put a question to you. The Economist today has asserted that when it comes to the delivery of the vaccines to Canada, we won't be able to make our deadlines. We've seen over the last 2 or 3 weeks that we haven't received any vaccines. So the global production capacity for vaccines and the whole of your portfolio, of course, it's extraordinary what we've done. But are we really going to be able to vaccinate 30 million Canadians before or by September? Is that really realistic?
Well, thank you for the question. And as I said, I don't believe The Economist is accurate on this point with the knowledge that we have here in Canada relating to the deliveries and procurements that I have mentioned here today. In particular, we are going to see a very rapid ramp up over the next weeks and months from approved vaccine suppliers alone. And as a result, all Canadians who wish to have access will have access prior to the end of September. And that is based just on approved vaccines alone, but we know we've got others in rolling review. This is the benefit of having a diversified portfolio.
Madam Chair, or rather, Madam Minister, it's like someone who wants to reserve cars with 7 dealerships and there's 5 who are not able to deliver these cars before 2022 or 2023, 2025. So how can we use these cars to drive when we're never going to get them for 3 or 4 years' time? That seems to be the reality. The vaccines are not approved. They're not in production. And as Mr. Champagne has said, there's different stages to get vaccine production going. So what we can see with the facts is that we will not have all of the vaccines by the month of September. And here I'm turning to Minister Champagne. You've said there's 4 stages to get this facility up and running. that's able to actually manufacture vaccines. I understand these stages. I'm a businessman myself. But the reality is that the UK has been able to retrofit companies. Oh, it's my dog jumping in. That's what happens when you're working from home. Yes, he didn't agree with you, Mr. Généreux. He's just expressed his dissent. Well, anyway, all of that to say, now, of course, I completely lost my train of thought. So in the UK, they have been able to retrofit plants so that they were able to manufacture vaccines very quickly. And we haven't been able to do that in Canada, and they're able to build hospitals in India within 2 or 3 weeks. Now, I've understood the sense of your question. If you'd like me to answer, I've understood that you put yourself in mute, but I've understood that what you're getting at, and to try and save time. Now, the UK case is very interesting, Mr. Janilo, because it often comes up. I would like to say that the UK manufacturing basis was very different from the Canada. There was more capacity already there in the UK, so that meant that they were able to do this type of scale up, because in Canada there's just 2 plants that have this volume in Sanofi and Toronto, and GSK in Montreal. GSK in Montreal, I'm sure you're aware of what they do actually in Saint-Foy. They're already producing a vaccine for the flu. So that manufacturing basis was lower in Canada compared to the UK, so that meant that they were able to move ahead faster. We have invested quickly and significantly to ensure that we could be prudent and resilient. And Novavax has chosen Canada, and I think that's a great leap forward in terms of approval. Yes, that's excellent news, but the reality is that we should have been able to move quicker towards that type of objective, because basically the vaccines were going to be approved. We could have already signed contracts. When I look at what you're saying to us today, it seems as if we're the most wonderful country in the world, as if we've got the fluffy unicorns. But basically, you're telling us that it's a different situation from what you've said. But you're saying that it doesn't seem that all the Canadians are not going to be vaccinated by September. What are you going to say when they don't all get inoculated? It's better to say it now. The reality is that this is not what is going to happen. Mr. Généreux, I've given you a bit more time because you were interrupted by your dog. I will let the minister answer.
Free to answer.
I will just like to say that I think the rhetoric needs to come down a little bit. What we are saying here is that doses from the approved manufacturers are going to be coming into Canada in the next weeks and months in full force. How do we know this? Because these vaccine companies began producing vaccines prior to approval and have evaluated their own production lines to ascertain that the fact that they are telling us that vaccines are available for delivery in Q2 are based on their own estimations of their production facilities. That's how we can be confident that 20 million vaccines of Pfizer and Moderna are going to come in Q2, and that 70 million will come prior to the end of September in total. That's what we need to continue to say. And undermining that point of view, saying that it's impossible to occur, is simply untrue based on what we are being told from the vaccine manufacturers themselves. That's what I'm relaying to you. It's not pie in the sky. It's not unicorns. It is based on what the vaccine suppliers are telling us as Canadians. Thank you.
Thank you very much, Minister Anand. We'll now turn the floor over to MP Erskine Smith. You have 5 minutes.
Thanks very much, Madam Chair. And I want to pick up on that need for clarity as it relates to the vaccine rollout schedule. And the numbers I have are with Pfizer and Moderna alone. And by the way, I think it's important that we don't talk about doses, but we talk about the vaccinations that can occur for individuals. I think that is clearer for Canadians, certainly for my constituents. So for those 2 companies alone that obviously have been approved, 3 million people will be able to be vaccinated on the delivery schedule by end of Q1, 13 million people by Q2, and 36 million people by Q3. Is that correct? And Minister Anand, is that correct? You're on mute, unfortunately. I see you nodding, but you're on mute.
Sorry about that. 3 million by the end of Q1, 13 million by the end of Q2, and 36 million by the end of Q3 of approved vaccine candidates alone.
And as it relates to the additional agreements that are in place, and obviously AstraZeneca has been approved in a number of other jurisdictions. One would think Health Canada could approve it in short order. If AstraZeneca is approved, how many people might be vaccinated based on that delivery schedule by Q2?
Well, thank you again. We are expecting doses of AstraZeneca in Q2. And once we have that regulatory approval obtained, we will be able to ascertain the delivery schedule with the supplier. And so I will ask my deputy minister here if he would like to step in and clarify anything else here. But I will say that there are variables that we need to take into account. First of all, in addition to these AstraZeneca doses under our bilateral agreement, we are scouring the globe for additional doses of AstraZeneca that we can bring into the country as soon as possible. And that is why we opted into the COVAX doses for AstraZeneca. The other G7 countries already have doses of AstraZeneca, so that was not something that they chose to do. And we are going to also work with our supplier itself to move up those doses as soon as possible. And those variables are really important to take into account. And I'll just hand it over to Bill Matthews.
I appreciate that. I a small amount of time as far as it goes. So I move on to Mr. Kennedy, actually, because the decline of capacity, domestic manufacturing capacity for vaccines is well documented back to the privatization of Connaught Labs in the Mulrooney years. But you are an ex officio member, and I see Mr. Kennedy is on. I'm not sure his screen is on, so I'm not sure if he is. Here we go. We've got him back. So you are an ex officio member of the vaccine task force, and I wonder. We have heard John Bell from Oxford in the media here in Canada say, well, the UK went from near zero production capacity to full-fledged production capacity. What were the conversations at that task force, and what if it was determined that it was not feasible to do the same thing here in Canada? What was the nature of those conversations, and what was the advice of the task force at the time?
So I apologize, Madam Chair. I just had to step out for just a brief moment, given the length of the committee meeting. So perhaps I can just try to give a quick answer. So I can't really get into the internal deliberations of the task force. I can say that we did meet and discuss with the UK vaccine task force. We were quite interested in learning the lessons from other countries. I can also say in this issue of the UK experience and the issue of domestic biomanufacturing, I said my ministry did an extensive survey of the biomanufacturing capabilities in Canada. We did that with the support of expert consultants. This was very early last spring in the early days of the pandemic. And I can say that in comparison to the UK, to take the UK as an example, the UK had a number of very large contract manufacturing operators that were capable of quickly shifting to produce COVID vaccine. The UK had also started years before the pandemic, in fact, in 2017, to launch a kind of a significant rebuilding strategy. And actually, one of the big facilities they're building, which won't be ready till later this year, they actually did the permitting and launched the construction in 2019, a year before the pandemic hit. And so, as Minister Champagne had said, you know, the UK certainly pivoted and was able to do manufacturing domestically, but they were starting from a much, much higher base, including kind of.
And on that point, Mr. Kennedy, no, I appreciate it. The last point I suppose is to be made is from constituents. They say, well, we want to make sure something like this never happens again, where we face a situation like this and we don't have the necessary national security fundamentally for our domestic manufacturing capacity for vaccines. Can you briefly, when it comes to Medicago, when it comes to Precision Nanosystems, Variation Biotech, the Biologics Manufacturing Center, I mean, walk us through briefly at least the investments that we are making to make sure this never happens again.
Sure, I can do this
very quickly because we're out of time.
I can just say that members will know that not every vaccine is the same. There are different platforms. There's messenger RNA, there's viral vector, there's protein. And so the advice we got, much as was the case with these international purchases, is to have domestic security of supply, we really need to be looking at investments across a portfolio of different kinds of manufacturing technology. And so that's those the investments that have been made. I can speak to this later if there's interest, but we've been trying to cover off those various kinds of technologies and platforms so that we're not dependent on just one thing. I'll stop there.
Thank you very much. That finishes our second round. We'll start our third round. The next round goes to MP Cumming. You have the floor for 5 minutes.
Thank you. So, Minister Champagne, there's been a lot of different companies that have come to light, including Precision Nanosystems, Providence, Ethos. So several companies have talked about their capacity and their ability to provide vaccines. And this was early on. Recently, we've seen that they've received funding. Why not earlier? Why not back into May? Like, why is there such a lag to actually getting behind some of these entities?
Well, first of all, Mr. Let me just say that it's a, we're willing and very happy to work with everyone who has raised their hand. If you just look at Entos, which you mentioned, which is in Edmonton, indeed on May 1st, they received, they concluded an IRAP agreement for $100,000. And on May 25th, they received about $4.2 million. In September, they received another $5. So if you look at a company like that, a small company, they receive almost $10 million. And my message to you, but also to all of them and other companies, we talk about Providence, which also received 10 million. This is good. I want more of these companies across Canada to be helping us to find the next vaccine, and we will be with them at every step of the way. But for people to understand at home what we've been doing, some of them, as you know, Mr. Cumming, are in clinical trials. So we provide them funding to accelerate the clinical trials, and we will be with them with the SIF fund when it comes to biomanufacturing if they get there. Because as Mr. Kennedy said, based on the question before, we have a very wide portfolio, and I could go through the various investments we made to make sure we would be well positioned. Sorry, I interrupted you.
Understood. Those are relatively in a $400 billion package that's been dealing with this. Those are relatively small dollars in the overall scope of things. But I was taken by Mr. Kennedy, and maybe Mr. Champagne, you can speak to this. So the UK recognized in 2017 that they had to get on with providing some of this domestic manufacturing. The government's been in place for 5 years now. What on earth was your predecessor doing? There doesn't seem to be, now we're reacting, but even in a small scale, we haven't proceeded with any kind of domestic manufacturing. I know you're new to it, and I appreciate the work that you're doing today, but where have we been?
But I would say, first to your other points before, Mr. Cumming, I just want to clarify that, for example, the investments that were made to the IRAP program, it's through the National Research Council. So those are the amounts that you were referring. They've been determined with experts and leading, you would say, scientists in Canada. Those are scientific decisions. They're not political decisions as to the level of funding. I just want to be clear that these decisions were taken by experts who say that's the type of funding you need for that type of clinical trials. And I just want to be clear with you and all members. If you have companies who want to help, please send them to me, and we'll see, and we'll provide it to the task force, which is giving the experts advice. Now, when it comes to the pandemic, again, we just have to go back a year. The pandemic was declared on March 11, and 12 days after, we were already there to invest significantly. I said 192 million. Within a month, we have put almost close to $1 billion to scale, because I think what you're saying, Mr. Cumming, is that we have these different companies in Canada, and I have a full list of vaccines companies across Canada. What we've been trying to do to react quickly with the Deputy Minister and the whole team was to scale very quickly to make sure that, based on advice, we would select the best one, which could be safe and effective, and could be available quickly to Canadians. So I think if you look at the record, we acted as quickly as possible to make sure that, and the investments like Novavax, you would agree with me, that's the type of thing I want to see. That's the type of thing I'm looking for to make sure we accelerate and we expand. So to the point of Mr. Perkins-Smith before, we will be resilient. Whatever comes next, whatever that may be, we will be resilient.
I want to be able to carry on. I still believe it's been 5 years late to the game. Minister Anand, I want to be able to get to you. It's clear that in the the vaccines, 13 million, 36 million. The numbers are large. Do you not see why it would be important to lay that out in a detailed plan so the provinces can properly react to those kind of volumes? Going from 6 million to 36 million is a hell of an effort that they're going to have to be made. They need to see a plan.
Unfortunately, MP Cumming, you're way over time. I'm going to have to stop you there because we want to make sure everyone has a chance to ask their questions. So I'm going to turn it to MP Assassi. You have the floor for 5 minutes.
Thank you very much, Madam Chair. Thank you to the ministers for being with us today. A lot of the information that has been out there has been misleading, but you have provided us detailed responses. Now, if I could start off with Minister Champagne. The previous member, my Conservative friend, was talking about Canada's capacity. In your assessment, the hollowing out of vaccine manufacturing that occurred in Canada between 2007, beginning with AstraZeneca, and all the way to 2014, where 4 vaccine manufacturing companies withdrew from our country, did that undermine our capacity to develop vaccines in this country?
Well, first of all, let me say thank you for your work as Parliamentary Secretary in helping, like all members, in helping to make sure that we have the best strategy and policies to make sure we can protect Canadians. And if you allow me, I'd just go back to Mr. Cummings' question before when he was talking about the level of preparedness. Mr. Cummings, and I apologize, I didn't have enough time to be fulsome in my answer, but I just want to say that we reopened when we came in government the Strategic Innovation Fund to biomanufacturing. And we will continue to. So to your point, I think now what we need to look at, all of us, is that we're building the pillars of our future resilience. So when we came, we invested in Medicago in Quebec City, which is significant, close to $173 million. Then we did a significant investment with Vino in Saskatchewan. And then we did Accelera. And this week we were able to attract, and I want to emphasize for members, attract Novavax to Canada. Because let's be clear, every country would like to have Novavax to go manufacture in their country. They chose Canada, and there's a reason why. And I just want to be fulsome to Mr. Cumming as well, because I did speak to the CEO of the company. And our policy when it comes to science, when it comes to investments, when it comes to ease of doing business, I've been key in his decisions. And you don't need to take it from me, but you just listen to him when he gave interviews in Canada. So what we're going to be doing together, and that's what we're trying to accelerate as quickly as possible, investing in small and medium-sized businesses as well, because I know Mr. Assassi and all the members, we all have SMEs in our regions, in our provinces, in our towns, which want to help. And I greatly welcome that. And that's why we supported them with the National Research Council. And those which were in a, I would say, in a stage which was more advanced, we could invest, for example, in terms of biomanufacturing to give them the resources to do that. And I think the Deputy Minister Kennedy explained why we did that, because also there's different type of vaccines. A bit when I look at our vaccination procurement, well, there's about 234 vaccines candidate in the world. We selected 7 of the most promising based on the advice of the task force. 2 of them have been approved in Canada in most G7 countries, and now deliveries are in Canada. When you look at the big picture, you say both in terms of procurement, but in terms of domestic scaling up of biomanufacturing, we did what we needed to do to ensure first that we would protect the health and safety of Canadians, and at the same time to make sure that we would be very resilient. And we're not going to stop there. I just want to reassure you, Mr. Assassi, and other member of the committee, I'm talking to different companies. We are going to make our country resilient. We will be well prepared for whatever may come next. And we're going to try to accelerate all these manufacturing projects to produce safely, because I think Canadians want speed, but they want something safe, as safely as possible and as quickly as possible to protect the health and safety of Canadians.
Thank you very much for that, Minister. Now, Canadians have heard by now that the Vaccine Task Force has done a tremendous job. They had to choose between 234 vaccine candidates. and they did a magnificent job. One of the committees that we haven't heard a lot about is a joint biomanufacturing subcommittee. Would you be kind enough to explain to us the tremendous work that that subcommittee has been undertaking for many, many months?
I think we should, as parliamentarians, on behalf of Canadians, to all be grateful. Like you said, they look at many, many, many proposals. Those are experts, and I've been told of story of members of that task force who are, some are doctors who are on the front line, and at the same time, we're kind of taking their phones and trying to provide advice, because I want to emphasize those are scientific decisions. They're not political decisions as to where you're going to invest. They made the screening. They decided which one would be safe and effective, and that could be available quickly to protect Canadians. Those were the parameters under which they operated, and now the chair is smiling and waving at me, which means that I would have to stop here.
Thank you very much. We'll go to next to Député Lemire. Vous avez 2 minutes et demie.
2.5 minutes, Mr. Lemire. Thank you, Minister Champagne. Well, we see that you are really establishing your mark as industry minister. We see that with your answers. You really want there to be autonomy for the Canadian industry, and you want there to be stronger economic sovereignty. The government has not been specific when it comes to measures to increase the global scientific capacity to guarantee our research, which is in your backyard. So fundamental research and applied research, and so they can have access to funds to really exploit our talents. What's the government going to do to ensure that we have investment and continuity with the next generation of scientists so that they can prepare for the next crisis? Thank you, Mr. Lemire. It's very good that you've talked about science because, first of all, before biomanufacturing, there's science, which leads us to this. I think we've already shown this. The pandemic was declared on the 11th of March, and 12 days, either on the 23rd, we were already pouring 192 million into the plan to mobilise science to ensure that we could equip people over and above what the National Research Council of Canada is doing. And we're going to continue in that vein because I think we can draw lessons from all of this. This is a one-off event, a pandemic. We see that once a century, and we need to draw lessons from this. We have reacted quickly, but as the Science Minister, you can count on me together with you, and no doubt the ideas that you and your colleagues will bring forward to see how we can better support fundamental science and applied science. It's thanks to these scientists, in fact. When I looked at different vaccine candidates, there's Medicago, but there's Variation Biotechnologie, and Precision Nanosystems, and GE Immunotechnology vaccine. And we've also got Providence and Biotrix in Laval, Vax in Montreal. There are lots of medium-sized companies, and this will bring high-quality jobs, keep researchers in Canada, and it will be great for our universities. They'll be more attractive because we'll have this manufacturing base that will offer possibilities to students. Just another question you can answer yes or no to respect the timing. Do you commit to invest more than your government has done up until now in research? Our government is the one that has made record investments in science, and we're certainly going to continue to support our researchers and scientists because it's thanks to them that we're in this good position in the country today.
Go to MP Davies. You have the floor for 2.5 minutes.
Thank you, Minister Anand. We know the EU, the United States, and Brazil have released contracts they've signed with vaccine manufacturers, although some of it's redacted. I'd like to know who's made the decision in the Canadian government not to release a single word of any of our contracts and why.
I want to start by saying that every country is different, given their domestic capacity, for example, and therefore the negotiations with countries and the resulting contracts are not identical. And so in terms of Canada's bilateral contracts with vaccine producers, there are a number of clauses that we as a government of Canada, as one of two contracting parties need to respect as a matter of law. And more importantly, perhaps, is that we don't want to put our vaccine procurements at risk. We all need vaccines. And if we were to disclose these contracts, we would risk receiving those vaccines because we would be in potential breach of contract.
Well, Minister, I'm a lawyer myself. I read my share of contracts. Are you saying that the confidentiality clauses in our contracts prohibit the release and disclosure of the entirety of the contracts or just parts of it?
The confidentiality clauses apply to the contracts as a whole, and I have gone back to the vaccine manufacturers to discuss this issue with them, and they are, as one of the contracting parties, very concerned to ensure that Canada respects its contractual
Mr.
obligations.
Champagne, you've mentioned that Canada has supported the vaccine production to the tune of billions of dollars. Have you obtained contractual conditions as attached to that public money that the vaccine production must be in Canada?
Let me, if you allow me, Mr. Davis, because I've not been privy to the specific contracts, as I'm sure you would be understanding, I can ask my deputy minister to provide you the details with respect to the terms of the contract.
Thank you, Minister.
Thank you very much. So I know that this is the time that the ministers gave us, and they gave us a little extra time so that we can get through the 4 parties for the 3rd round. So I want to thank the 2 ministers for being with us today and for answering the questions that many of us have. With that, I will now allow the ministers to leave. We will continue our rounds with the deputy ministers and other representatives from the departments with us. So we will now turn to MP Dreeshen. You have the floor. Thank you again, ministers, for your time, and thank your teams for us on our behalf.
Thank you, Madam Chair, for welcoming us and for allowing us to provide details to the committee. Thank you very much. Merci tout le monde. Bonne journée.
Merci beaucoup tout le monde.
Thank you to everyone. Have a great day. Goodbye.
You have the floor for 5 minutes.
I don't know how to leave.
MP Dreeshen?
Well,
oh, you're on mute.
okay. Thank you very much, Madam Chair. And as it was, I may want to be able to share my time with Mr. Nader as well. And so I'll just a couple of comments that I would have. We had just heard from the minister as far as contracts were concerned. That is one of the 2 contracting parties that that could decide whether or not they wanted to have some of the details held in confidence. But are some of the contracts that are being exposed from other countries, are these not the same companies? And if they are, then is it not then Canada that is the one that is holding it up? And of course, you know, if these, it'd be interesting to know whether these negotiations, if they're not identical, why it is that we've been suffering. And is it perhaps the reason why we don't want to show how difficult it is?
Merci. Thank you, Madam Chair, for the question. I think just to maybe further elaborate on the comments Minister Anand made, it is a contract between 2 parties, and the differences you will have to keep in mind with other countries is where there is manufacturing occurring in other countries that the government may or may not have been a party to in terms of financial investment or other pieces. That then drives a different discussion around potential disclosures. So we're certainly not in a world where we are interested in potentially being in breach of contract, especially given how important the product is. So that's, and it is a contract between 2 parties, as was already said. And that's, I think, all I can offer on that front.
Okay, so to another point, we keep hearing how we will have procurement possibilities for hundreds of millions of doses. Of course, we don't need hundreds of millions of doses. So what actually happens to the value of those doses that we have procured, I mean, is that worked into the price that that one might have to pay if you know you're only going to maybe at the most get 100 million, but you're telling all of these suppliers that you know you could get as many as 400 million from them? And if that is the case, the difference between 100 million and 400 million is just to pay back the those that we're going to be taking from the COVAX fund.
Thank you, Madam Chair. A couple of comments. When the contracts were put in place with the 7 different manufacturers, again, this was during last summer at a time when nobody was certain which vaccines would actually make it across the line. We have 2 that have made it through regulatory approval and hopefully more to come soon. So that was the reason. And companies were taking risk to basically do research, clinical trials, and start production at the same time. So there was a need to sort of pony up if you wanted your foot in the door early. In terms of what happens if they all come to fruition and Canada gets more doses than we need, well, there's abilities to donate. As has already been mentioned, no one's really sure what the durability of these vaccines are. Is this an annual thing? So they could be folded into future years' vaccines as well. So there's flexibility there. And I think, frankly, it's just too early to say what will happen given the various stages of regulatory approval.
What is the capacity of Canada to be able to supply doses to those people that need it? And I'm asking you, we say that there could be as many as 2 million a week and so on, but I know that there's a lot of unique things that people are talking about as to ways of getting vaccines in people's arms. Does anybody know what the capacity is of the Canadian medical system to be able to actually get these doses into Canadians?
Madam Chair, I'll be pretty brief here because we are drifting into public health agency territory, but key point here is provinces and territories have a key role in the actual final mile to get vaccines into people's arms. I think the 2 vaccines that are in play right now, Moderna and Pfizer, as I think all are aware, have fairly specialized shipping and storage requirements in terms of cold temperatures. Some of the other vaccine candidates do not have those rather rigid requirements. So it does open up a different list of possibilities in terms of how vaccines might be administered. But those are discussions that the Public Health Agency is having on an ongoing basis with provinces.
Certainly. And so therefore, my last question is going to be, we seem to are lulling people into the idea that the end of September would be a great time to have all of this done. Why couldn't it be done by the end of June?
I'll be very brief on this one. The end of September date is driven by the quarterly allocations of the 2 approved vaccines, Pfizer and Moderna. To the extent that additional vaccines are approved and deliveries occur, obviously that date can be pulled forward, but end of September is based on 2 vaccines and quarterly allocations from those companies.
Thank you so much. Our next round of questions goes to MP Joe Harry. You have the floor for 5 minutes.
Thank you, Madam Chair, and once again, welcome to both PD ministers. Let me start with Mr. Kennedy. Mr. Kennedy, just want to follow up on the question that you kind of ran out of time to respond from my colleague, MP Erickson Smith. And you're talking about the various type of vaccine that's being developed, and you're going to touch on the investment that we have made. Can you expand on that, please?
Yeah, thanks, Madam Chair. Look, I could just say, I guess, as a kind of a, just generally speaking, if you look at the portfolio of international vaccine candidates that the government has purchased, there has been an effort to make sure that there is a number of each of the main different types of vaccines. So the ones that have been approved are using messenger RNA, but there are other vaccines that are protein-based. There are viral vector-based vaccines. So there's different major platforms for vaccine production. And in the same fashion, when it comes to the efforts to boost Canada's biomanufacturing capacity, there has been a deliberate effort to make sure that there are investments that are going to different kinds of platforms. So, for example, Minister Champagne mentioned the investment in Medicago. Medicago is a plant-based virus-like particle vaccine. He mentioned the investment in Vito Intervac. That's a protein subunit vaccine. If I look at the investment in Providence Therapeutics, that's a messenger RNA vaccine. So the efforts on biomanufacturing and the support that the government has given to the various Canadian vaccine candidates to advance their clinical trial work have been across these various kinds of technologies. So the idea is not to put all of our eggs in one basket, it's to kind of have multiple eggs in multiple baskets.
Thank you. In opening remarks by Mr. Champagne, Minister talked about the suitability for COVID-19 vaccine production, even among those existing vaccine producer in Canada, and said the capacity is already allocated for some of the flu vaccine. Two questions. Number one, what would be considered as a suitable COVID-19 vaccine production? What qualifies or what is it unique about that? And why, as part of the either the vaccine task force or joint biomanufacturing subcommittee, did we explore into working with those existing facilities to expand their capacity?
So, Madam Chair, I'll just try to give a brief answer because it's a very kind of technical answer to give a full answer, and I don't want to pretend I'm also a technical expert, but I would say that we did a full survey of all of the assets in Canada. As Minister Anand had noted earlier, there were very active discussions to see whether we could get technology transfer to have some of these candidates produced in Canada. You need to match up the candidate that you want to transfer with a facility that can handle it. And it's a bit of a mix and match. So, for example, there are certain of the vaccines that actually have to be produced in a certain level of biosafety. You can't produce them next door to some other product. There are other vaccines where the biosafety level can be lower. If you take, for example, GSK in Saint Foy, have a facility that makes seasonal flu. That's an egg-based technology. The messenger RNA vaccines that are currently approved and are being used, they are not able. You don't produce messenger RNA using an egg-based technology. So, the challenge is you've got to have technology that's aligned to the vaccine. But then the other thing that Minister Champagne said, which frankly I think was really the more important and more salient point, is the companies required scale to really make it interesting. I noted the honorable member, Mr. Davies, had asked, well, what about Korea? What about Mexico? I just took a quick look at the capabilities in South Korea. South Korea has facilities that have bioreactors that actually can handle hundreds of thousands of liters of substance. In Canada, generally, the facilities we were dealing with, we're talking about a few thousand liters, 5,000 liters, et cetera. There are
Madam Chair, I lost.
Mr. Kennedy, we've lost your audio. I've paused the clock, but we seem to have lost your audio.
My apologies. Okay, is it
you're
back?
Yeah.
It's just maybe I'll stop because I don't want to take up too much time. But it's just to say, Madam Chair, that the international facilities that were generally partnering with AstraZeneca and others, they were able to produce at an order of magnitude far higher than any facility in Canada could produce. And the challenge for the companies is technology transfer is really is a time-consuming effort. It isn't like getting a muffin recipe and you kind of get the ingredients and you make it. Typically, it's 6 months or longer. You have to do small lots of the vaccine and prove you can do it. The technicians from the company have to be on site to check everything. And so these companies, when they were allocating effort, they had to focus on facilities that could produce massive amounts, not smaller scale facilities that could produce a smaller amount. Thanks.
Thank you. That was great.
Thank you so much. So we're going to, because we have a few minutes left, we're going to start round 4, and I'll give each party a slot to be able to answer some questions. So we will start with MP Nader. You have the floor for 5 minutes.
Thank you, Madam Chair. And I'll start with Mr. Matthews from procurement. Mr. Matthews, Minister Anand mentioned that she had read the entirety of the Pfizer and Moderna contracts. Have you also read these contracts?
Yes, I have, Madam Chair.
Thank you for that. Could you determine or let us know whether there's a specific clause within that contract, and could you give us some information on that clause that causes that entire contract not to be disclosed to parliamentarians?
The contracts themselves are confidential, and that was across the board. I mean, this is an industry where they're very sensitive about protecting their IP, et cetera. And even to enter into negotiations with these companies, you actually have to sign an NDA. And so it is a very sensitive piece. And so I think I've already answered that the Canadian contracts are confidential, and we are very, as the procurement department, we take very seriously the government's obligations under contracts, and we want to make sure we respect those.
Thank you for that. Now, I'm not a lawyer. I'm just a farm kid from Logan Township. But would an order of this committee or an order of the House produce the contracts to be reviewed in camera? Would that trump those non-disclosures?
All I can say, Madam Chair, is I take the obligations under the contract very seriously, and any potential breach of a contract not only would limit, I think, potentially limit the ability to get vaccines, but it will also compromise future negotiations if you're viewed as a department that doesn't respect contract clauses. So we take our contracts very seriously at PSBC.
Thank you for that. I just find it interesting, that AstraZeneca and the European Union have come to an agreement to disclose parts of that contract. The United States has disclosed parts of theirs. I find it interesting that our negotiations have not provided for at least some disclosure of those contracts. I want to move on to the deadline that has been put out time and time again by the government, that all Canadians who want a vaccine will receive one by September. Again, I've heard again today that the amount of doses is being determined by quarter. What reassurance can you provide this committee that we aren't going to get the bulk of that allotment in late September for that third quarter, thereby making it impossible for provinces to actually get needles into people's arms before the end of September that's been promised?
Thank you, Madam Chair. So we have ongoing discussions with the suppliers about schedules. They start in earnest as regulatory approval gets closer. The notional quarterly allocations were set out in the summer, again, long before production was up and running. So we do have discussions with suppliers about the need for, steady, even flow of products, just for that very reason. We do want provinces and territories to have time to ramp up. We are still in relatively early days. I think, mid-December, third week of December was when the first doses started arriving. And so the plan is for those companies to ramp up production. And as they do, Canada gets an increased allocation, on an upward curve. And that gives, that matches the ability of provinces and territories to ramp up their delivery efforts right alongside with the production ramp up that companies are actually seeing.
We've often been told that we need to be receiving 2 million doses per week to meet that September deadline. At what point in your estimation will we get to the point where we be regularly receiving 2 million doses per week?
So it's a ramp up by quarter. I think we know what the allocation is for next week. Still early days in terms of Pfizer and Moderna, but there is a fairly steep ramp up. But it's not a straight line. So the math I think that was done was simply dividing the number of weeks left by the number of doses, and there is a fairly steep upward curve. And as provinces and territories become, more familiar with what's required to administer this vaccine, their ramping up of the actual vaccine delivery is happening as well.
But could you at least give us an estimation of when you expect to at least hit that 2 million dose mark? Are we talking, early April? Are we talking early June? Are we talking early July?
I think I can talk to you by quarter, and I think the minister's already shared that, in Q1 we're expecting 6 million doses in total of Pfizer and Moderna, and that's, you don't get there all at once, but there's a ramp up to kind of meet that need. Keep a close eye week to week, and you will see these things start to come up.
Thank you for that. I see I'm out of time, but I just note, there does appear to be a significant risk that so many of these doses are weighted toward the end of the third quarter, that we have a significant risk these will not arrive in time for all Canadians to have a vaccine by the end of September. Thank you, Madam Chair.
Madam Chair, if I could just interject that the plan is Q2 bigger than Q1, and there's a steady ramp up in Q2, and that's really where the vaccine effort gets quite intense.
Thank you very much. Our next round of questions will go to MP Lambropoulos. You have the floor for 5 minutes.
Thank you, Madam Chair, and I'll be splitting my time with the member Assasi. I never engage, or rarely ever engage, in partisan politics, but what I don't like is hearing, the opposition constantly say that we will not be meeting our September targets when it's clear that in the contracts, and when people who have actually been negotiating these contracts are saying that we will be meeting it by the end of September. It instills fear in Canadians, and it uses fear in order to gain support from Canadians. And I don't think that that's the way we should go. If you can send one message to Canadians about vaccines and about, whether or not Canada is on the right track to receive the amount that they've said they're going to receive by September, and we're going to have Canadians vaccinated by a certain date, what is that message?
Thanks, Madam Chair. I can only speak to it from a contractual perspective. So we have enough vaccines under contract of the 2 approved vaccines to get all Canadians vaccinated. We have delivery schedules that will get us there by the end of September. And as more vaccines get approved, should they get approved, we have a chance to improve on that. But it is a steady ramp up of deliveries. These are production lines that are still relatively new. So it makes perfect sense that early Q1 deliveries will be smaller than Q2. So this is a steady ramp up, and there's enough vaccines under contract of already approved vaccines.
Thank you.
Thank you to my colleague for sharing her time. Now I'd like to go to Mr. Kennedy, if possible. Mr. Kennedy, I found your testimony to be very, very helpful. Unfortunately, it appears, according to what some of the members are saying, that we're drawing parallels between the UK and Canada. You rightly pointed out that the retrofitting in the UK started in 2019, and that you have been examining their approach to biomanufacturing. Would you like to elaborate on that so we all understand full well that capacity in Canada and the UK were not the same?
Well, Madam Chair, I think we are working very diligently to support the government in rebuilding Canada's biomanufacturing capacity. But I think the main point, which I think is indisputable when looking at the facts, is we're starting, unfortunately, from a much lower base. So the UK is home to 2 of the world's largest pharmaceutical companies that are actually both involved in the production of COVID vaccines, GSK and AstraZeneca. They had, going back many years, actually, even earlier than 2017, they had a fairly sophisticated strategy for life sciences that involved, investments in the sector. I believe it was 2017. I'd have to triple check, but they had actually launched discussions about kind of further reinvestment in their industry. This is something actually the Vaccine Task Force actually looked at in terms of, kind of were there lessons learned from the Canadian experience. They are in the process of constructing now, as an example, their Vaccine Manufacturing and Innovation Center, which will be a large facility that will be partly dedicated to research and partly available for commercial vaccine production. As I said, the contracts for that were let in 2019, and it is not finished being built yet. My understanding, based on the analysis we've done, is some of the equipment that their contract manufacturers are using to make COVID vaccine actually has been relocated from the facility under construction to contract manufacturers. So I think the main point is the UK actually started from a much higher base, has a larger contract manufacturing industry, had already been actively investing and studying and consulting and had shovels in the ground to build further capacity. And in fact, they were actually able to borrow some of the stuff that was already in flight when the pandemic hit to pivot it. There's just really no comparing, the situation with Canada. I think Sir John Bell's comments about all things being equal, it would be better to build stuff domestically. We share that sentiment 100%. And obviously for the future and for next year and beyond, the objective would be to be in exactly that position. But, if you cast back 9 months, 10 months, there was, the conclusion of our, kind of leading experts, and from the analysis we did was, the notion that we build a brand new factories from the ground up, have them licensed, do the tech transfer, and commence vaccine deliveries. That would have been a risky proposition, to say the least. And so, I think there are lessons to be learned, but we're in a very different position than the United Kingdom. I can assure you of that.
Thank you for that.
We'll now go to Député Lemire. Vous avez 2 minutes et demie.
You have 2.5 minutes. Thank you, Chair. Thank you to the witnesses. So, Mr. Matthews, perhaps you could answer my question, but I'm putting it to all 3 of you, in fact. Is Canada ready for a mutation of the virus? Will we be able to adapt? Will the Canadian strategy be able to be resilient with this mutated virus, and will we still manage to vaccinate everyone by September, even if there is this mutation? I can answer a question, and perhaps Bill as well. I'd just like to say that that is one of the reasons why we've committed with Novavax to have local production. It's not just for the vaccine now, but it's to cover possibilities in the future if we need booster jabs or a new version of the vaccine, and the work that's underway with other investments, including investments in Medicago and other Canadian options, is so that we can be prepared if it turns out that we need new versions of the vaccine. That's certainly one of our priorities when we're talking about biomanufacturing. Would you like to add something to that, Mr. Matthews?
Madam Chair, this probably is a really important question, probably a better question to be posed to the health experts or the vaccine experts, because they are certainly actively watching the various variants that have emerged and wanting to understand how their vaccines hold up against those variants. And it's too early to say, as far as I know. That's a better question for the health folks.
Vous avez eu accès au contrat, pas nous.
So you've had access to the contracts, not us. Now, there were two recent meetings between the Prime Minister and the US President, and they talked about collaboration to fight against COVID-19. What do you think is going to come out of those negotiations?
I'll be very brief, Madam Chair. I can't speak to what the Prime Minister and the U.S. President spoke to. I'm just not in a position to share. I'm sorry.
OK. Bon, ben, ça va.
Okay, that's it. My time's up. Thank you.
To MP Davies, you have the floor for 2.5 minutes.
Thank you. Well, I must say that I'm left with some confusion about AstraZeneca, whether or not Canada's not manufacturing here because we don't have the capacity to do so, or because we didn't negotiate the right to do so. Amir Adaran testified at Health Committee this week, and he said, the National Research Council knows how to make vaccines. Its brilliant scientists were the world's first to fully deploy an adenovirus vectored vaccine for rabies ahead of any pharmaceutical company. Why can't the federal government seal a licensing deal with AstraZeneca to make its adenovirus vectored COVID-19 vaccine for Canadians using the NRC's equipment? So my first question is the reason the NRC isn't producing the AstraZeneca vaccine in Canada because they don't have the capacity to do so, or because we didn't negotiate the right to do so?
Madam Chair, perhaps I can start, and then I'll ask a colleague to talk about the contractual negotiations. It is a fact to say that the researchers at the National Research Council are familiar with the technology underlying the AstraZeneca vaccine, and in fact, the facility that is being built, the biologics manufacturing facility, would have the capability to make that type of vaccine. The important matter is, of course, the company with whom you're going to strike a deal to pursue that. And in this case, we announced earlier this week the MOU with Novavax, which is to pursue production at that facility and in line with our capabilities, which have been mentioned. I'll ask my colleague if he'd like to provide further information in terms of the discussions that were undertaken with each of the vaccine manufacturers, including AstraZeneca, which I think Minister Anand did address that it was part of those conversations at the early stage.
If I may, I have limited time. I'll just ask my last question, and whoever wants to answer it can. So Minister Anand confirmed that we tried and failed to get domestic production from AstraZeneca when many other countries did. We know that the EU, the US, and Brazil can release contracts or significant parts, so they obviously didn't have the same restrictive confidential requirements that Canada did. And you're telling us that successive federal governments have let Australia, Brazil, Mexico, Argentina, India, Japan, South Korea, China, and other countries get domestic vaccine capacity that Canada doesn't have. My question is it safe to say that, relatively speaking, it's pretty clear Canada did a relatively poor job both in negotiations and in pandemic preparedness?
Very quickly.
Well, Madam Chair, I can just give a brief answer on the issue of capacity. The countries the honourable member mentioned had in place at the outset of the pandemic substantially greater biomanufacturing assets available. South Korea has huge, kind of biomanufacturing capability. As Minister Champagne mentioned, the Serum Institute in India, that one facility alone, is slated to be producing more than 1 billion shots for COVID. These large multinationals, when they were looking to, produce and looking to kind of, dedicate scarce resources to technology transfer, were looking for facilities that could produce at scale. And as has already been noted, Canada did not have surplus capacity to produce at scale. And certainly the facilities we do have, and there are excellent companies here, we either had the wrong technology or were already dedicated to vital products like, pertussis, polio, diphtheria, and those sorts of things. So I'll stop there.
Thank you so much. And that is our time for today. I want to thank Misters Matthews, Kennedy, and Davies for being with us and for staying a little extra time to allow our members to ask these vital questions. And I want to thank the members for excellent questions today. I think this was a great meeting. Again, merci beaucoup au service de traduction.
Thank you very much for the interpretation services, the clerk, the analysts, and the IT service.
And as you know, we will have the vaccine task force with us the week of the 15th of February. So if you have additional witnesses that you would like to hear from with respect to this study, please make sure to get those lists to the clerk so that he can reach out. Again, it could be a rolling list. You don't have to have your final list. That would be fantastic. So with that, I call this meeting adjourned, and I'll see you next week. Thank you.
Madame la Présidente, permettez-moi de m'excuser.
Sorry, I just want to apologize to everyone. There's the guilty party himself. Is he a Maltese terrier? No.